I've spoken about how soy consumption may lower the risk of developing breast cancer, but can it improve outcomes in people who have already been diagnosed with breast cancer? This systematic review and meta analysis, including 32 articles, evaluated the associations between soy isoflavones, also called phytoestrogens, soy protein, and overall soy product consumption and outcomes in those with breast cancer diagnoses. They also looked at phytonutrients from some non-soy foods and beverages, but I'm going to focus on soy for this video because, let's be real, that's where the controversy is. Overall, those consuming the most soy isoflavones had a 26% lower risk of breast cancer recurrence compared to those consuming the least, and the certainty of this finding was graded as probable, with the certainty of other findings I'm going to discuss being graded as limited suggestive evidence. The reduction in risk was also most clear in postmenopausal women and those with estrogen receptor positive breast cancer. And the dose response analysis suggests that the largest reduction in risk was a 30% reduction in recurrence in those consuming about 60 milligrams of isoflavones per day. That's roughly equivalent to about 2.5 to 3 servings of tofu or soy milk per day. And for overall and cancer-related mortality, the results tended to suggest a lower risk, but the results for most findings were not statistically significant. However, those with stages 3 to 4 breast cancer who consumed the most soy isoflavones had a significant 42% lower risk of all-cause mortality. Higher soy protein and soy product consumption was associated with a 52% lower risk of breast cancer recurrence, and in those with estrogen receptor positive breast cancer, higher consumption was associated with a 25% lower risk of breast cancer specific mortality. So soy is sounding pretty good. And the Canadian Cancer Society recognizes the potential benefits of soy consumption and states that soy is unlikely to harm breast cancer survivors and that eating soy foods may help improve breast cancer survival, especially in postmenopausal women.